in business.
Good afternoon, Thami, and good to be with you.
So, the World Health Organization says the world is nowhere near achieving universal health coverage. What could be causing those delays? What are the challenges that you've identified?
Well, there are a number of challenges that are present in a lot of developed and underdeveloped countries as well, but most of them relate to resources. If it's not financing, then it certainly is the availability of healthcare workers, doctors, specialists, nurses, and so forth. And so we see in the developing countries the typical national health systems buckle under the pressure because they aren't producing enough doctors and specialists and nurses to actually provide the services. And so it's becoming very expensive to actually deliver services. And typically, the developed countries are coming into Africa and other developing countries and trying to poach healthcare staff, which puts additional pressure on developing countries, specifically like South Africa.
Well, going back to South Africa, as you've mentioned, you will know that the country's been working on the National Health Insurance Bill since 2019. It is a bill that's been met with some fierce opposition. So the Profmed 2025 State of Health report shows that 75% of South Africans believe that the NHI will worsen healthcare and that more than 60% lack confidence in the public system. I'm quite astounded by these percentages and these numbers. And it begs the question, what was your sampling demographic like?
Yeah, so a Profmed actually is a medical scheme established by healthcare practitioners, so the doctors and specialists. We have about half of them are present on our scheme. So many of the surveyed results comes from that grouping. But the context is important because these doctors have all done their training in the public sector. So they are well familiar with the state of health in the public sector as much as they work currently in the private sector. And so that context is important. So inevitably, the discussion started not just to ask about NHI, it was almost testing the quality of services in South Africa across the healthcare sector, both public and private. And so the initial questions were around the perceptions about health services and then what reforms are required. I mean, it was evident from the feedback that people didn't believe the NHI Act and the way that South Africa has chosen a policy to drive universal healthcare had any chance of success.
May I,
And
Craig? May I,
yeah.
Craig? Just for the sake of clarity moving forward, would it be more accurate for us to say the South African, perhaps professionals within the healthcare industry, 75% of them say this and 60% of them say that? Because it's very different when you're talking to the layman and woman in the street, because now you're talking about, 75% of the population, which is not the case here. It's 75% of healthcare professionals.
Yeah, you're absolutely right. So the reason why it's such a key unit is that we've seen in the opposition to the National Health Insurance Act, the very key role players like the doctors and specialists that have to perform the service in a future NHI are the same ones that say this is not the platform that we want to be involved in, or we don't trust that this will accomplish what needs to happen to deliver better services to the community. So you have to divorce the promises made, and we often refer to it as the political promises made, which are unrealistic and there is no funding for it, to a space where you want to actually keep the doctors engaged and you want to keep them in the value proposition to assure them that in a future universal healthcare context, they are needed and are the most valuable resources and cog in the wheel to make a success out of that.
One of the things that you've mentioned is that you say it's time that the country has healthcare reforms that are grounded in economic reality, not these political promises, the phrase that you've used, and that they also need to be grounded in constitutional responsibility. What are some of the reforms that you're proposing, and how can those reforms take into account South Africa's economic reality and that constitutional responsibility?
Yeah, so first up, what we do know is that South Africa spends sufficient money to achieve better healthcare outcomes in general. So both in the private sector, where healthcare is expensive, the private sector needs reform as well. But the private sector offers a lot of skills and some capacity which it can share and should be partnered with to provide additional services in terms of the public sector. And so together, if you build a platform that involves and collaborates across both the public sector resources and the private sector, you can actually have very quick wins that won't take 10 or 20 or 30 years that is currently the NHI plan. Plus, on the one side, we haven't seen budgets actually improve. So there is no additional money in that can be redirected into the NHI. When we start talking about what benefits NHI would provide, those benefits haven't actually even been tabled at all. That hasn't been spoken of. And if it is similar to a comprehensive package of benefits, it's going to cost anywhere close to, people have said, 800 billion to 1.3 trillion rand per year. I mean, that's 3 times the size of anything spent on Eskom. So we know that there is no realistic funding, additional funding that can come into the healthcare debate, save that we use the resources we currently have. We protect the doctors and specialists and nurses, and we try to retain them from the rest of the global demand. And also we do better in terms of the funding that we have available. So we use the capacity in the private sector and make sure we create efficient, corrupt-free funding in the public sector.
I mean, you talk about the funding issue, and I just wonder that the Government of National Unity has been advocating for these public-private partnerships. How key do you believe these partnerships are in reforming the healthcare system and indeed providing this additional money in order to be able to breathe life to this NHI and then ultimately achieve that World Health Organization goal of achieving universal health coverage by 2030?
Yeah, the wonderful thing is there is a universal healthcare index available, and it's based on the WHO principles. So South Africa features currently at 70% on that World Health index, and so we have to do better with what we've got, and how to lift it to 80 or 90% with the current resource available is the real goal that we need to pursue. And I believe that if we can do better in terms of managing the spend more efficiently, both in the public purse and in the private sector, if we do it smartly, we can build trust that attracts more investment. We can build trust that attracts either more taxes and more resources into our healthcare system. And so that's the real approach that we need to move to.
Craig Comrie, it's been a pleasure speaking with you. Thank you so much for putting all of this into perspective for us, and also just taking us through the outcomes of that 2025 State of Health report. That's CEO of Profmed, Craig Comrie, who takes us to exactly 4:49 Central African Time.